Welcome to the Regulating AI podcast. We are coming live to you from the Future of AI conference by Financial Times Live in London. Today, I am glad to be joined by Dr. Ryan Abbott, who has an incredible background. He's a renaissance man of medicine and law. And we're going to talk about some regulations in AI. We're going to talk about some global frameworks, governance, and all those other interesting things. Welcome to the Regulating AI podcast.
Well, thank you. It's an honor to be here.
Wonderful. Dr. Ryan, you wrote a very interesting book on AI about robots. Can you talk a little bit about that book to our audience and what was the purpose behind writing that?
Sure. Well, the book was examining how advances in AI capabilities require us to rethink some of our rules around how we govern AI behavior, AI development, and AI use.
Mm-hmm.
And in particular, it was examining the phenomenon that AI increasingly behaves like a human being, but that current laws may not appropriately respond to that. So for example, I have a car that can be self-driving, but if it causes an accident in exactly the same way as a human being, a different liability framework applies to that, strict liability versus negligence liability for me. Or my academic employer is constantly trying to replace me with a chatbot. And if they do so, they save on taxes because you have to make national insurance contributions for a human being, but not a machine. And so, different legal frameworks govern behavior by a person and a machine, and sometimes that has negative social consequences. On the tax side, for example, it encourages businesses to automate to save on taxes, even if it's not otherwise productive. And in the automobile context or the liability context, having stricter liability for AI behavior may reduce the adoption of safer technologies. Or one of the areas I've been particularly active in of late has been AI generating creative or inventive sorts of outputs. But laws around the world may not recognize intellectual property rights in those outputs, even if a human being had created the same thing, and looking at whether or not that's the right system.
Okay, there's a lot to unpack there. So let me just go back a little bit. Are you saying that if AI, which you said is a machine in some ways, is doing some actions, who is responsible if there's a liability that is taken on? If in the case of a car, let's just say full self-driving, if take any, the question becomes, is the manufacturer responsible? Is the driver responsible? In the system of AI, is the developer responsible or the implementer responsible?
Right. It's a great question. And one of the kind of perennial issues around AI risks is who is responsible. And this is something that governments around the world are looking at and making sure there aren't liability gaps. So far, there's been no significant harm caused by an AI that someone hasn't been responsible for. But to give the lawyer's answer, it depends. It depends very much on the facts of the case. So if we're sticking with automobiles, my self-driving car capabilities requires me to be alert and keep my hands on the wheel. If I fail to do that and the car causes an accident, I might be liable for it. If I am following the guidance and the requirements of a human driver, it might be that the manufacturer of the car is liable. Generally, when you have a commercial product that malfunctions, the manufacturer or supplier is liable for it. Okay. So in most cases, AI is a commercial product and there is a responsible party. Between developers, users, owners of systems, and so forth, a lot of the liability there is worked out by contract. So if you use an AI platform, you may, take on liability for what you use it for, or the licensor of the program may take liability for it. But it is important when you have harms caused by AI that you do have a clearly identifiable responsible party, which can be difficult when complex systems break in complex ways.
Okay. So let's just go further into a little bit about what you said. So in terms of medicine, there is this whole topic of use of patient data. In terms of the use of patient data, do we have a responsibility to pay the patients, or do we have, is it fair game to use patient data? Because that's a question that comes up on several of our guests that come up. Some people say, hey, patients need to be compensated.
Right. Well, this is another one of the perennial questions, and it's a conversation we've been having a long time in other contexts. And it is, I think, a normative question whether you believe patients should be rewarded for that. For example, in the United States, physicians have been innovating on the basis of patient data for a very long time, or patient biosamples. This begs the question: can you own personal samples from your own body, your organs, your tissues, if they're used to make medical innovations for new genetic advances or for new drugs? Do you get a piece of that? Generally the answer in the US has been no, you don't.
Okay.
And this has been thought to make it easier to innovate for pharmaceutical, biotech companies, physicians, because they don't have to, carefully track where samples are coming from and compensate patients. And also a sense that, these samples aren't really something that someone is investing labor or effort or investment in. They're just sort of a natural response. If you follow that vein of things, patient data, in the US at least, is not something that innovators have to pay patients for. If anything, it's something they pay aggregators or physicians or providers who aggregate or validate data for. Now, people have suggested that we might want to reward patients, and a reason for that might be, well, it distributes some of the benefits of innovation. It encourages people to share their own data. On the other hand, while we do reward innovators with, intellectual property rights and other sorts of incentives, ultimately the beneficiary of innovation is the general public. And so there's also a sense that patients are benefiting from sharing data because they exist in a more innovative environment. That's a long way of saying there's costs and benefits to it. In the States, we don't currently do that. Some people think that we should, but historically, we haven't done that with similar sorts of things.
Okay. So as you said, so far the precedent has been that we've not done it, but if, things could change if patient data is being used for training purposes, et cetera, because we are in uncharted territory. True.
Well, the training thing is a whole separate issue, right? So a lot of machine learning requires data to train it. Where people have asked for compensation is where that data is protected by copyright. So data per se is not something that you copyright. You copyright the expression of ideas. So you might, copyright, an essay you write or a painting you draw or a picture you take, but facts are not protectable by copyright. So generally, training machines on patient data is not something that patients receive compensation for, although there may be data sharing agreements with healthcare institutions or insurers or aggregators, and they get compensated.
Okay. That's very helpful to our audience. Let's just talk a little bit about international governance, especially as it relates to healthcare. In the EU, they've passed the EU AI Act. In the US, we've had over 100 bills have gone through. We don't have, and we won't have a comprehensive AI regulation. We'll have maybe sectoral regulations. When I talk to members of Congress or Senate, they say, hey, we already have a lot of laws on the books. The FDA has passed and gone through so many medical devices that use AI and things of that nature. What is your view? Do we need a health-specific AI regulation in the United States?
Well, I think, as you said, we have a number of health-specific regulations, right? If you mean, do we need an overarching AI-specific regulation?
Yeah.
No, I don't think we do. I tend to make a more sectoral-based approach to it too, because it's very complicated. The issues that arise from using AI to drive a car or automate labor or generate creative materials are really very different, right? They have different risks. They have different use cases. I think a blanket, concern about using AI does run the risk of really disincentivizing the use of a technology that's going to cause widespread social benefit. That isn't to say there aren't risks. These risks, have laws that do address them already, and some of those laws need to be rethought a bit. But, the risks of using AI in a medical device are very different than the risks of using AI to make a painting, right? So I don't think one size fits all is an appropriate response to legislation.
Okay. So, coming to healthcare, whenever I talk to our guests on our podcast, healthcare is considered the number one area of potential opportunities. I've had people come in and say that we're going to have cures for most diseases that we know in our lifetime because of AI. And I've had entrepreneurs come in who are producing AI-based medicine. And also we've had regulators come in and say, because of digital twins and things, the approval process, because the approval, the phase one, phase two, phase three, as you know, is really, really long. Tell our listeners, what do you see? Because you have a very unique perspective. You're not just a physician. Physicians are great. Just being a physician is hard enough, way above my pay grade. But you have a real different perspective. What do you see? I mean, obviously, there are a lot of challenges, and we'll talk a little bit about that. Where do you see the biggest excitement is in healthcare? In your view, where do you see the big opportunities?
Well, it's a good question, right? There is certainly a vision now of AI transforming drug discovery, for example, right? You can have AI do things like generate new virtual molecules and model how those will perform against known targets. You can do, model drug-drug interactions. You may be able to significantly shorten a regulatory pathway by having better AI modeling and shorter clinical trials and things like digital twins. So there's a vision of this. It has not yet come to fruition. There are a lot of companies now that are working very actively on this, and there are a number of drugs in development that are AI outputs, right? Now, people remain typically very highly involved in the AI-enabled drug discovery process, right? So you have people building these models, training these models, selecting data, iterating output, testing output in bench laboratories, doing clinical trials. So the AI hasn't taken the whole thing over, but there is a vision of it thinking the industry. And I think this would be fantastic for patients because it is incredibly difficult to get drugs approved for good reasons. And if AI can help dramatically lower the cost, we could have a lot more useful therapeutics and we could have a much more personalized approach. We have a very non-personalized approach to medicine, which is based largely on clinical trials, often of skewed demographics of people, and how those respond to an individual patient is very hard to predict. So I am looking forward to a future in which AI both gets a lot more drugs on the market and helps us make our treatments a lot more targeted. When that's going to happen is very hard to say. This vision has been around for a long time. A lot of money has gone into it lately. You have people like Sam Altman and Elon Musk saying we're going to get artificial general intelligence in a few years. You have other very well-respected technologists who think it won't be in our lifetime. So, unfortunately, it's hard to predict exactly when this AI vision is going to come into fruition. But my personal view is that AI is only going to get better at doing all of these things. Human beings aren't getting better. And so it is almost inevitable if we stay on this path that AI is going to dramatically transform the provision of healthcare services. And clinically also, it may do a better job in many instances of diagnosing disease or performing surgeries than a human being. It may really limit medical error. And again, I think the beneficiary of all that is patients mainly, because we'll just be getting better care and living longer, healthier lives.
So let's go to the point of patient care. Health equity is a big, big issue around the world. If you look at the global south or even parts, go to the US also, you go to rural areas, etc. AI has an opportunity to change that dramatically in many instances. That's at least is what is being said right now. But do you think there is an ability to really make that difference and in a short period of time where you can provide, at least using telemedicine and AI, providing that in places where you can't get physician, there's a physician shortage, forget about in the global south or other places in the US, and we have a nursing shortage on top of that. And I'm sure it's in the UK too with the NHS systems. They are backed up dramatically. Do you think that's going to have an impact in terms of delivery of healthcare?
I do. I think, the real question is when the systems are going to get that capable, because they clearly aren't right now. I mean,
Hmm.
telemedicine is certainly a no-brainer in that, you have a physician shortage in the United States, for example, in rural areas, not in big cities. You have an over physician supply because physicians want to live in the middle of LA, Chicago, New York,
Hmm.
San Francisco. There's really, unlike say the practice of law, there shouldn't be a lot of state differences in how you practice medicine, and so promoting telemedicine, I think, is a very good decision. Generally there are some things a patient has to be in person for, but it is helping to improve access, and including international telemedicine. Now, when you have AI that is able to meet or exceed the performance of a human physician or healthcare provider in certain areas, that will really help improve access also. And there are some FDA devices that are approved that AI can autonomously diagnose certain disease conditions where the evidence does suggest it can do better than a human physician. But these are very narrow indications, things like diabetic retinopathy, which is very difficult for most physicians like myself to diagnose by looking at it, less if you're an eye specialist, but it's hard to know when computers will actually get there. And in the meantime, if they aren't quite good enough, there is a risk that they're causing more harm than good. I will just say it's very difficult to predict. When we have AI making creative things now, AI has been doing that for a long time also. The past couple of years, we really just saw this release of LLMs that
Hmm.
do a very good job at it. And even then, 2 years ago, the creative stuff they were making wasn't so great. Now I can go on Google Gemini and have it make very good creative images in 30 seconds.
Hmm.
So be prepared to be surprised at the speed with which AI does get to the point of being useful for improving health equity and how quickly it improves from there.
So you don't know when, but you're positive that it'll happen, and it'll happen hopefully sooner than we think, which is a great thing to talk about. Finally, what about privacy? I mean, health data, data privacy. There's obviously a lot of concern about that with AI. Uh, we don't have a privacy law in the United States, unlike we have a HIPAA, which I presume we all know. How old is HIPAA? It's what, 30, 40 years now since it's been in the books. Firstly, do you think HIPAA needs to be updated given the current environment? And what are your concerns in terms of patient data privacy as far as AI is concerned?
Right. Well, I mean, we have a host of competing demands, right, that we're seeking to balance. On the one hand, we want to promote privacy. On the other hand, we want to promote people training AI models that do useful things. So we have to
Hmm.
balance these. As a practical matter, the EU has GDPR, and a lot of the international providers really have to be compliant with that anyway, because it's very hard to have multiple systems for multiple markets. There are also US states that have very strong privacy rules, as strong as GDPR, like California, which has CCPA, or Illinois.
Hmm.
It's difficult for serious service providers in the US not to be compliant with those because everyone wants to operate in California. It's the biggest state market. And once you're compliant with one of those systems, you are pretty much across the board.
Yeah.
The concern is more disharmonization of privacy laws and a risk that, doing one thing under one is prohibited by the other. But clearly data privacy is important. Clearly it is something that needs to be regulated. It is through HIPAA federally and through state privacy laws. There is a significant burden to companies complying with these rules. It is expensive. Lawyers are expensive. Compliance is expensive. But that's one of our competing demands. And I do think it would be helpful to have, perhaps a federal regulation on privacy to preempt a patchwork of state laws. But it is something that clearly needs to be protected.
Any just brief thoughts? There are now a lot of um, healthcare based AI tools also that have come up, sectoral ways where people are training it based on that. What are your views on that?
My views on training AI to be useful in healthcare.
Yeah, I mean, people are just, focused on sectoral rather than a general purpose. Let's say Chat GPT is a general purpose LLM, an LLM that's just focused on, health or a specific health. And I know that there are large health systems like Mayo Clinic and others that are training it on their data, et cetera.
Yeah, a lot of people are fine tuning or training models like ChatGPT or Llama to do specific things, and I think that's important. Some of these systems will perform better if they're trained on specific data. So the Mayo Clinic may have access to data that OpenAI doesn't have access to, and they can do a better job at fine tuning their model. You know, what we've seen has been that generalized models tend to outperform models specifically built to do something, but fine tuning general models can be very helpful also. And I think it is likely for the immediate, for the near term future that you're going to have models that do much better when they're trained to do specific things than something like ChatGPT doing everything. I certainly wouldn't go to ChatGPT to diagnose my disease, but I might ask it for its input on what it thinks about something, and, reading it with a great grain of salt, might get some useful insight.
Um, Finally, I mean, large language models are trained largely on, the internet, which is English-speaking, Western-oriented, but also has a bunch of biases in there. Um, for someone who is, using it or things of that nature, how do we make sure that, that those biases or things of that nature are not there, especially from a healthcare standpoint?
Yeah, it's a great question. Well, these biases that are, present in AI from training on biased data, I think are reflecting historical biases,
Mm-hmm.
right? So it is a bias that existed before, it's a bias that's continuing. I think one of the benefits of AI is that you may, in some instances, be able to better detect biases and correct them than you can in a human being, because you can make rules for AI to follow. So I think it's a very important concern, but I do think it's one that may have almost a better solution with AI than we have with people.
Okay. Uh, we just finally, quick lightning round question, just one word answers from you. Open source or closed source?
Open source.
That's pretty good. Um Synthetic data or human generated data?
Hmm. Depends on the use case.
That's a lawyer. Uh, uh, the potential for AI in healthcare, promising or scary?
Promising.
Okay. Finally, for our global audience, one actionable item that you can leave behind for people who are thinking of AI policy in health or thinking about AI innovation, please speak to our audience on that.
I think it's important for policymakers to, think clearly about how AI is going to be disruptive and what laws can best result in more social benefits and fewer risks for them. And that may be taking existing laws and changing things to make sure that they're fit for purpose with AI behaving like people.
That's incredible. Thank you so much for being on the Regulating AI podcast. Your background in AI. I thought I was talking to an AI company CEO, and medicine and law really has given us, including me, a great perspective on the intersection of AI regulation, AI policy, and healthcare. Thanks for being on the podcast.
Thanks so much for having me.
You bet.